So my day at Biorasi as a CTM, I would say I start with looking at my calendar to make sure that how many meetings are there and how much time is available for me to ensure all the activities that I have planned for that day are completed. Apart from CTM role, of course, we are also supporting all the other initiatives. We also have this monthly all hands meeting, which are very good platform to understand how things are going at company level. And it's important to know because sometimes you are so much involved in your project related activities that you do not keep track of the other activities which are also important for you as a in your professional career. But specific to project, I need to make sure that at what phase my project is. We need to have close communication with our project managers, make sure all the deliverables are clearly communicated to the team. After the project management meeting, I have to make sure I'm able to give enough time to my clinical research associate who are working very closely with doctors who are the main key people, I would say, in clinical study, because they are the one who are collecting the data which will be submitted to FDA. So I make sure that I have enough time for my CRAs to answer all their questions and make sure that they are doing their job properly and they are equipped with all the tools they need for doing their job effectively. As I said, like at company level, we are doing a lot of other initiatives. Like one of them is Project Symphony. I would say it's really something different which I have not seen in other companies, because you usually have your job profile defined for your role, and then you have your one-on-one meetings based on your job responsibilities which are discussed in your job description. But in Project Symphony, though, the difference is we will create a person-specific development plan. So, for example, if you know you have achieved a lot of things in last 1 year, and you really don't have to wait for next 3 years to go to the next level. You can start that discussion right there, discuss what you have achieved, where you need to focus for next 6 months or 7 months, so that you can go to that next job level or next activity that you want to take up, which is over and above your current role as a CTM. That's the best thing about Project Symphony. You have your customized growth path for an individual. I think that's a new thing that is happening, and I'm really excited about it. Leadership, yes, of course, we had a lot of good number of changes in last two years, and I would always say on positive note. After Chris joined as a CEO, I think we have seen a lot of good things happening in quality as well. Mamta, I think a lot of process came up, which is really helping not only the quality department, but also all other departments, mainly clinical. We are now very good at capturing all the deviations. There's a transparency. People can learn from that system because everything is posted on the in Chronos on the intranet, and that's a good thing because I can learn from what mistakes other projects are happening and how I can avoid those, because you can see the issue, the corrective action. That's a really good thing, I would say, for a CTM role.